Hello, hello, hello.
Sorry. Sorry. Thank you. ମୁଁ ମଝିରେ हाँ हाँ मॉडल भाई आसिए हाँ मॉडल बाजू में रखिए हाँ हाँ मैं सेट कर लूँगा टेंशन मत लो
Hello.
ठीक ଅଛି ठीक ଅଛି ଆଉ ଗୋଟେ ଖାଲି ପିଲା ଗୋଟେ ଦେଇଦେ ହଁ ଆଚ୍ଛା ବିନୁ କେତେ ଟାଇମ୍ ଯାଏ ନେଇପାରିବି କେତେ ଯାଏ ହଁ ଏମିତି
सर आप 1:30 जाए ଦେଇପାରିବେ
ହଁ
11 AM 1:30
ଆଚ୍ଛା ଆଚ୍ଛା
ତାପରେ 1:30 ରେ ଲଞ୍ଚ ଅଛି
ଆଚ୍ଛା ଠିକ୍ ଅଛି ଠିକ୍ ଅଛି ନାଇଁ ନାଇଁ କିଛି ଦରକାର Good afternoon, dear friends. Good afternoon, dear friends. I hope I'm audible to all of you. Great. Thank you. Now, as soon as we start with a beautiful program like this, which is concerned with manual therapy, and you see a person who is dealing with health and fitness, it's very surprising in this sense that how and where is it getting connected? Shall I prove right in the beginning? Shall I start with that? Most of you, how are you sitting right now? You're slouched, you're reclined. What about your spine? Can you ever think about that the best of the best manual therapy given to your lumbosacral region right now will sustain at the sitting posture which you're right now? That's where fitness comes into play. That's where Pilates comes into play. That's why the topic today, Pilates as a multi-dimensional format. How? Let's make this a very interactive session. Sit straight, sit up straight. Thank you for obliging me. Keep one of your hand right on the bottom of your tummy and the other hand on the side of your tummy. Sincerely, without cheating me, close your eyes, focus and try to get a top quality contraction. Are you feeling similar amount of contraction on either side, right on the front of the tummy and on the side of your tummy as well? Give me an honest view. Are you feeling the same contraction? It's your same body part. The brain is same. Neural supplies are also similar. How on earth that on one part you get a quality contraction, on the other side you are not getting one? This is motor control. And here Pilates and mind-body exercises comes into play. How? With focus. Let's try a very similar and simple exercise again. Right on the chair. Are you there with me? Slide little front of your chair. Everybody ready? Yes.
Yes, sir.
Thank you.
This line, sir.
All right, thank you. So now that you are already on the front of your chair, pull up your pelvic floor and your lower tummy. Get a posterior pelvic tilt. Slowly try to recline back to the backrest now. Very slowly. Hands may be kept in front. Just slowly, but don't recline. Just go close with a posterior pelvic tilt and hold on. Come back. Now this time, put the same hand on the same part of your tummy on either side. Do the same exercise. Pull up the pelvic floor, pull in the tummy, close your eyes, posterior pelvic tilt, try and recline back, but don't recline. Hold it there. How much amount of contraction do you feel? On the front, on the side? Honest view. Do you feel that? Do you feel that? That's it. That's what Pilates has to do. And did I do something on mat? You did it right on your chair. We were having the esteemed guest, and I was hearing one of the guests using a very beautiful line, illness to wellness. I was so happy hearing to this. Why? Because if we complain that we are spending 8 hours to 10 hours to 12 hours on chair working, this chair can be our exercise equipment. We just did that. So why blame the chair? Usually, when we talk about health, we often use a term, and this term is usually described like this, that the health is not here. Can you understand this? The health is not here, it's here. So this is an understanding that whether you are on the chair, whether you are on the mat, whether you are on the beautiful couch, it's about your involvement, whether you want to turn it into a quality exercise or not. And that's where we have to come into play and understand that even when we have this top beautiful science of manual therapy being given to your patients, being given to your clients, those who are suffering from different ailments, you need quality exercises to support it. Because if you do not have quality exercises, then we do this, what we have been doing on the chair. And then we can't blame manual therapy that it's not working. It's because we didn't give it its supportive friends. And that's where exercise comes into play. Now, let's bring another very important component of exercise science which is coming from Pilates. And when we are saying about or talking about Pilates, let me be very open and honest. There's no Pilates without yoga. This is a revelation. On stage, on an international stage, yes, there can never be a Pilates without yoga. And there can never be an yoga and Pilates without breathing. So now, let's start with a small chair activity again. Get back to the same position, slide to the front of your chair, recruit the lower tummy. Have you already done it? Get a chin tuck. Now, while doing a chin tuck, just make sure that you are able to breathe. Generally, when we are training Pilates, we often use the word 9-9 to be pronounced so that we check whether we are breathing or not. हिंदी में कहा जाता है जिंदगी हो या पिलाटेस सांस हमेशा कंट्रोल में होनी चाहिए. तो कंट्रोल में रखिए, बंद नहीं करना है. क्या करना है? Don't hold it, but get a chin tuck, only that much, till which you can breathe in and out. Let's do or repeat the same activity. This time, add the hands in front of your body, as if you are ready to hug Lord Jagannath. Posterior pelvic tilt. Breathe in and fall back, but don't recline. Did you know what you did just now? A segmental stability exercise for the lumbosacral region. A segmental stability exercise for the lumbosacral region, and that involved breathing, which is one of the primary components of Pilates as well as yoga. This is what mind-body exercise format has to support manual therapy with. Why? Because we all know, those who are practicing manual therapy, that segmental stability exercises are a primary requirement of long-term management. And what you did just now was a chair-seated segmental stability exercise. Does that make some good sense for all of our friends? Will you be able to utilize it in your office, in your presentation, when you're taking it probably in a corporate sector? Let's go ahead. We have just talked about something related to the chair-seated position. Would you like to see some magic? Some magics? Sure? So this magic is about core magic. Let's get into some core magic. Can I know both of your names? Vivek, please come. Parth Sarthi, come here. So we have Vivek and Parth Sarthi here. And we are going to show some magic on them. We are going to do some core exercises, world-class core exercises, top quality core exercises. What is the quick format of exercise that comes to your mind when I speak about let's do some core work? Yes? Crunches, all right. What else? Planks, great. Neither one of I will do that. And we'll have a core on stage. And we will have a proof. No guessworks. One of the therapists will be palpating, the other one will be doing the exercise. You judge yourself and take a call whether this is going to be useful for you or not. All right? Are you ready? Ready to see some therapy magic? All right, great. Now, what you need to do first is, come here, sit down like this. No, he will sit down. You stand up. You need to insert your hand on the tummy. It's a tiger claw. One finger goes on right on the rectus abdominis, central area. The other fingers are right on the side of the rectus abdominis. Same with the back side. Do you see this? But the lateral thumb area, I want it on the flab. Ready? Try and do it. Thank you, sir. Thank you. Right? Do you feel his muscles? Or do you feel his tummy? Don't expose him on the stage. All right. So he has got a tiger claw grip. One finger is right on the rectus abdominis, central line, linea alba. The other two are on the sides of the rectus abdominis. The thumb and the little finger I would love to place it in his flabs, or non-technically called as the love handles, if at all you're in love. So, once you're holding on to this, once you're on this area, you're in a position where you can palpate almost every abdominal muscle, including the deeper ones. Core, because the idea of core is not transverse abdominis. Idea of core means deep muscles. When you say, I love you from the core of my heart, do you have a transverse abdominis in your heart? That's funny. Core means deep, deep contraction. So that's why when you're trying to get a quality recruitment of these muscles, we can do a very simple thing. Ready, Patsati? Should I do the magic? Lift up one leg, stand on one leg. This. If your thumb can go a little deep down, around 2 inches inner to the ASIS, that's where a transverse abdominis also you can get. Do you find it very tight and taut? Relax and put your legs down. It's loose? Patsati? Yes. So towards the audience, the magic is supposed to be seen by the audience. Now, once again lift it up. Do you feel it tight? All around, all the fingers? And even in the back as well? Now, Vivek, you can just put on your hands this way and get your leg moving in a small circle. Do you find the contraction moving in a circular pattern as well? Now, this is multiplanar core activation. Leave everything aside. Chhod do. Chhod do. Let's do a simple activity of standing here with our hands wide open. Thoda Shah Rukh Khan banna hai. Wide open, lift up your leg and balance that. This is, in Pilates, called as the star. The star is a core activity recruiter without a plank, without a crunch, without any activities that needs you to lie down. Why do I need all these things? That's because if you're having a pregnant lady with a low back pain, how on earth are you going to modify the exercises which you're supposed to do on prone lying? This is an exercise. That's how Pilates gels up with manual therapy, or yoga gels up with manual therapy. And this is not finished. Magic remains more. Do you want to still see some more magic? Great. Now we'll turn it into a sports core activity. Yes? Again, Path sir. Sit down like that. Same way. Same palpation. A little bit leg raise. Hands also raised up. Flip flop your hand a little bit. Do you feel the core activation already? This is not at all a rocket science. I'm simply using basic physics. As soon as you raise up your arms, the center of gravity is raised up. Balance is disturbed. When the balance is disturbed, you are forced to recruit the core muscles. And if that center of gravity is repeatedly moving or changing its position, it's a great trouble for the core muscle to manage. And that's what we are doing in this mobile star. How do we do that? Now do it alone. Lift up your leg and just flip-flop your arms. This itself is a fantastic core activity. Again, from the Pilates. Now, on a funnier, on a lighter aspect, what you can give, as we were hearing the Honorable Minister on the stage describing that at every grassroots level, we need a yoga teacher, we need a physiotherapist. I have a small addition and a humble addition to this. What if they can be joined in together? One, it saves money, it saves time, and it saves a lot of effort as well. And that's what exercise can do for you. You have to think about it, that whether prehabilitation is a part of your profession or not. There are people who are earning millions and millions out of it. Why not a physiotherapist? Let's go further ahead. Are you ready for a few more magics? Sure? That's great. That's encouraging, because if that feedback is not coming, probably the magician will be lost in the magic. All right, so you've just seen something very active on a standing position where we tried to recruit. Now, many of you would be using mobilization techniques for the lumbosacral region. Let's come down to the lumbosacral region, what Pilates can bring about into this, what yoga can bring about into this. As the topic is a multidimensional approach to manual therapy, let's learn about it. Many of the times when you are training your patients with sacroiliac joint dysfunction, did you know, which is a very common disorder with geriatric group, with pregnant group, chair-seated group, corporate group, anybody who is sitting for a longer period of time is expected to have some sacroiliac dysfunction. Now, understanding that, diagnosing it, I understand you're well equipped and perfectly knowledgeable to do that, so I'm not getting into that. I'm going to help you out with some more magics. And these magics will again be discussed by these two our friend, Vivek and Parthasarathi. Something that we often forget is, what do I support my sacroiliac joint mobilization with? Or what can be a quality sacroiliac joint self-mobilization? Can I do it at home? Can anybody do it at home? Let's see. Pull in the mat at the center. Thank you. Lie down. Legs toward me, preferably. This side, head that side. Legs. Are you able to see him? Yeah. So lie down in crook line. Bend your knees. You see there's a hip width gap between the knee. Now, what we are trying to do is load up the sacroiliac joint to its best capacity. Increase the gap more than hip width. Now, twist your knees towards one side, both of them. That also. Do you see that there's a gap between the knee and the floor? And the harder you try, you can't reach it. He's trying his best. This itself is a sign that the sacroiliac joint is already stiff. Right? And what do I do? What do I do with my exercise format? How can I turn it into diagnostic feature or a treatment purpose? For treatment purposes also. A very simple thing. Again, turn it down. Come down. I can help you with this. Stabilize the pelvis. Press down the knee. And honestly tell me, where do you feel the pressure? And on the back? Yes? As soon as you go down with your knee, that's right back on your sacroiliac joint. Such a fantastic exercise that even a third trimester pregnant lady can do this. Now, the magic is not finished over here. We'll immediately turn it into a self exercise. Come on, self exercise in this position? Yes. Go down. Lift the bottom leg. Put it on this knee and try hard to press down. You can put your arms. Right? A simple exercise that mobilizes the sacroiliac joint as well as the little higher lumbar vertebrae also. Now, what is the purpose? Why did you jump from the core section to the lumbosacral region? Because they are connected. If you have treated a lumbosacral spine and directly gone into core muscles, you didn't even give them with quality management at the joint level, probably the core muscles will do more harm than anything else. So that's why the sequence, the best sequence would have been a manual therapy, the joint training as in this, the exercises, followed by stabilizing core muscle exercises. Now, lie down. The one that you just did on your chair, that exercise where you had your arms raised up and you had your pelvis tilted backside and you were trying to recline down, that exercise is called, in Pilates terminology, the imprinting. It is called as the imprinting. Printing means kya? Chhapna. Imprinting. What do you want to imprint? Where does this come from? By the way, the word Pilates is not pronounced as we are doing it. Because very often when I go across into multiple scenarios, people end up telling different words for Pilates. It's sometimes called as pilates. It is sometimes called as Pilates, right? But the original word is German and the pronunciation is Pilates. Pilates. It's not pilates. It is not Pilates. It's Pilates. There is no ta, there is no sa. It's Pilates. So when you're trying to practice with Pilates, what do you do? Crook sitting again. Crook sitting. Give me your hand. Sit. Yes. Gap a little more. Yes, that's better. Now, you can palpate. Sit down beside him. Kneel down. Kneel down. And just palpate his front tummy. Loose है? Loose है बेटा? पार्थसारथी? ठीक है? Now, get that posterior pelvic tilt. Tilt behind. Make sure you're breathing. घबराओ मत, छड़ी नहीं मारूंगा मैं. Rounded back. Slowly recline down. Slowly नीचे जाइए, नीचे जाइए. Slow, 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 slow. Come up again. Come up. Again that posterior pelvic tilt. Recline down. Try to go slowly. I would love to go like this. Do you feel it very strong when it was there already? You can come back to sitting again. Vivek, you can come back to sitting again. अभी आधे रास्ते पे ही रुक जाना है. ठीक है? ताकत लग रहा है ना? ना कोई वेट यूज किया है, ना कोई रेजिस्टेंस बैंड यूज किया है. It's just a self exercise and so see with one belt he's panting already. And that's the power of a quality Pilates exercise. Won't that help a post-manual therapy patient? Again, arms, a baby hold, we call this a baby hold position. Posterior pelvic tilt, rounded back, धीरे धीरे नीचे जाओ, जहां मैं बोलूं वहां रुक जाना. रुक जाइए, सांस चलाइए. कहा था ना सांसों को कंट्रोल में रखना है. थोड़ा ऊपर आइए, थोड़ा नीचे जाइए. Just repeat that. That small angle. Do you feel the load coming up? इसमें एक आधा केजी का वेट अगर हाथ में आ जाए तो? That's the answer. This is segmental strength training at its peak. A powerful exercise. Thank you. Recline down for some time. Now, we haven't done, this is a progression of what you just did on the chair. You can do this imprinting right on the mat. We didn't use any weight, we didn't use any machines, and that's why we often tell that if you have a skilled hand, sell off the machines, you don't need one. It's enough for giving quality health. And that's what you just saw right now. Many of you, thank you, stand up. Many of you might be doing facial mobilization. How many of you have come across this term, facial mobilization? Kindly raise up your hand, be generous. Thank you, thank you. One exercise to do everything? Would you like to have one? Just one exercise. You don't need to do anything else beyond that. Works out the entire fascia. Ready? Shall we do? Great. But for that, you will have to stand up. Yes. Other than the teachers, everybody can stand up. Sir, please, you can sit down, you can sit down. Sir. Teachers and dignitaries, please sit down, please sit down. It's so, it's a very simple thing. Make your lumbar lordosis little bit exaggerated. And watch carefully what am I doing. I've given you my side view. The movement must come right from the hip. Sir, please sit down. Sir, please. Get that lumbar lordosis exaggerated and stand at the hip width distance. And get down, get flexing only from the hip. Only from the hip. One exercise. And if you're honest with your joint, you're stretching your calf, you're stretching your hams, you're stretching your low back, just simply raise up your arms on the side. Make sure your knees are taut enough and they're not slouching. Now add a little upper limb fascia stretch as well by extending your wrist. Is it not a magic? Now push your butt a little behind. Lumbar lordosis maintained. Bring the arms in front and start crying with that pull. Is it not that one single exercise, and this hand, let me tell you, before putting you into any kind of difficulty, this hand can be put on a wall. This hand can be put on a chair. It's not something that is going to come out from the blue moon that nobody can perform. This is a simple exercise which everybody can do right on the wall. That's it. A fascia stretch. And let's not forget the traditional Indian Hastapadasana. That's where the beautiful science of yoga is getting connected to Pilates. Thank you very much. Please sit down. Thank you. Now, when we say that we need traditional arts to be inculcated into therapeutics, this is how our traditional art has already given us connection into our therapeutic management. We have now seen how we can recruit about the core, how we can recruit about our segmental areas into strength training, how we can recruit about a very simple method to get a fascia stretch. Let's move on into some other areas, which again will have a fantastic experience. What about the knee? Let's see some magic on the knee as well. Ready? Sure? Will I have your attention? Great. There are some certain things which are called as functional exercises. Now these functional exercises are 6. No human being can ever be fit without doing these 6 functional exercises. It's a confirmed guarantee. You can take it as a challenge. If you're not involving these exercises in your regime, you will never be perfectly healthy. Are you listening carefully? 6 of them: lunge, squat, push, pull, twist and plank. These are the 6 functional exercises. कुछ भी करिए, इस पे आप योग कर सकते हैं, इस पे आप पिलाटेस कर सकते हैं, इसके आप स्ट्रेंथ ट्रेनिंग कर सकते हैं, रेजिस्टेंस बैंड कर सकते हैं, but if you're not doing these 6, it's incomplete. And now let's see what our Pilates training can land about bringing into this functional training as well as sports training. Topic is, remember, multi-dimensional approach to Pilates and manual therapy. Ready? Great. Now, while standing, there is something in Pilates which is called as a core recruitment. The person who devised this Pilates format by name was Joseph Hubertus Pilates, J.H. Pilates, or Pilates as we say it. Now, he devised a word which may not be very anatomical. The word that he used for the midsection was powerhouse. The word which you will find into his textbook is powerhouse. When he uses the word recruitment of the powerhouse, that means 30% recruitment only. Please make a note. It's not, there's a difference between, again see me carefully. I have kept my hand on my tummy, on my glute and on the back. This is also a recruitment. This is also a recruitment. What is the difference in between? In this, I am turning around and I am talking to all of you. But is it possible to talk? Not. So this is the difference between a 30% recruitment and a suck-in. Whenever we are performing Pilates, it's only a 30% recruitment. Am I clear about it? Has everybody understood? Thank you. Now, with this 30% recruitment, what are we going to gain in? We are gaining the powerhouse recruitment. Step forward. Ready? Sure? Where is my palpating therapist? So what you can do right now is to go down and palpate, believe your fingers, and palpate all direction around the knee. No, I want that, Matt. Matt चाहिए बेटा. मैट के ऊपर पाँव रखिए. मैट चाहिए. एक पाँव मैट के ऊपर होना है. ये अंगद के पाँव हो गए. हाँ, कहीं वो रावण तो नहीं है. Bend down a little bit more. Fingers on the top. Thumb behind. Lunge more. Sure? Raise up your hands. Start shaking it. Now in circles. Do you find the contractions all around? Parthasarthi? I'm going to pull this mat out of your feet. Ready? You have to protect it. Keep moving. Don't worry, I'm a kind man. Alright? Do you find the contraction? I haven't done anything increasing the joint range of motion. I have not put him into a tremendous deep squat, just a small range of lunge. And that's where we have proofs where he's finding quality contractions. This is a therapist magic. You know what it is happening right now? He has got a lunge and his entire weight is being balanced by the front leg now, a major portion, and shifting up the arms into circle is disturbing the center of gravity. On the top of that, when I am getting into a pulling of the weight bearing surface, both the things have to be managed by the periarticular muscles. around the knee. And that's where a powerful firing starts occurring. And that's what is standing Pilates lunge. Standing Pilates lunge. This is another gift of Pilates which we can utilize. It can be in sports, it can be in geriatric training, it can be in any kind of knee manual therapy, post manual therapy workouts. So this is an overview about how you're going to utilize this for the knee. Let's go further. Ready?
Yes.
Are you ready or you have gone off to a doze? Sure? Great. This side I think is resting. No? Kindly raise up your hands if you are not resting. Thank you. Great. I can see so many hands. So encouraging. Thank you. Thank you so much. Now, if we are used to certain training programs from the PNF side, सर PNF कहाँ चले गए? अभी तो पिलाटिस बढ़ा रहे थे. पिलाटिस ऐसी चीज़ है जो योग से निकला है और योग ऐसी चीज़ है बिना उसके कोई एक्सरसाइज बन नहीं सकता. तो इसीलिए कुछ ऐसी चीज़ें भी सीखते हैं. Let us learn certain things which is connected to everything from yoga to PNF to Pilates and directly to our manual therapy techniques. This is a PNF chop technique. Get wide open. Hands raised up. Look at my position. इधर देख लो एक बार. Screen. Get back again. Keep swinging. Don't touch the floor. It's halfway through. Now while doing it, focus and close your eyes and focus on the powerhouse recruitment. Pull up your pelvis. Pull up your pelvis. Nobody can check that. Hands up. Suck in your tummy. Swing down. Sorry. How about this? You could have used a resistance band for the same purpose. A chop technique, which is again going to work out right from the hip, and the original component would have been with the knee. This. है? करोगे मेरे साथ? एक साइड थक गया लग रहा है. ठीक. दूसरी साइड लगाओ. Get the knee moving. When you're doing down. Can I have everybody standing? Thank you, please. Teachers can sit down, others can. Raise up your hand. Raise up your arms. Raise up your arms. And stand up only if you have enjoyed the previous standing exercise. One hand on the lower tummy. Recruit the lower tummy strongly. Get the hands raised up. Eyes closed. Focus on your glutes and the pelvic floor. Pull them up. And then go into this movement where you're having a chop with a mild knee bend. And do it slow. Kindly do it slow. With the spine moving. Relax back. Relax back. Thank you. Thank you. Just imagine, thank you, be seated, be seated. Just imagine if there was a resistance band attached to your arms. This itself could have turned into a powerful segmental strength training format of exercise, where the band is tied on the top corner and you're pulling down. This is such a powerful exercise which can train the hip, train the knee, train the spine, train the shoulder at one go. And this is called as the Pilates chop. Is it something unrelated to physiotherapy? Aren't you reading this in your PNF topics? Right? The same way around, let's learn certain other thing which is connected to Pilates, yoga, manual therapy, and the last few things before we conclude the session. The thoracic region. All of you must be having some or other kind of nicks and pains sometimes, studying. Let's see how you can help out with your thoracic region. Are you also? Sure? We have a candidate here. How do we mobilize that? Self-mobilization, right? Work out that, strengthen it, and in very few exercises. Ready to see the magic again? Sure? Let's start with the chair. So, probably if that matches your height, sit down on the chair, lock below. Keep it loose, not too tight. Don't go and hug. Right? It's loose. Hand clasped. आप अगर ध्यान से मुझे देखोगे, Vic, I'm not slouched in this. I'm straight. Flat. Flat spine. Clasp your hand. Now, just move your neck up and down. The spine is held tight and firm. Where do you find or palpate his movements? Go on to his thoracic spine. Palpate with your hand. Deeper. And this also goes deeper, down. Keep moving. Make sure that the tummy area doesn't slouch. Do you feel the movement? Do you feel the loading on the thoracic region as well? Vivek. A beautiful, simple exercise which can be done on a chair, which is considered to be the most biggest villain for thoracic problems. Turn into an exercise regime. Now this magic can be done by a therapist only. It's not done, it's not finished. We have some magic right now. Ready for a few more? But this magic, I would love to tell you, first, this belongs to your own loved country, this exercise science. That's why I repeatedly tell, with most of my classes, that kindly design your own exercises, put researchers behind it, and if possible, copyright them. Otherwise, there will be many Pilateses, but no yoga. And that's why, please, make sure that you are at least having few copyrights and patents on your designs which you make. That's important. Clasp your hand behind. Stand up. Pull it behind. Bend forward at 90 degrees. Raise up your neck. Where do you feel the load? Right in the upper thoracic region. Right? A simple exercise. In yoga, this is called as the Dvikonasana. It is called as Dvikonasana. Now, you might feel a little concerned seeing the next Pilates. Thank you. Relax. I'm looking like a Hitler torturing. You might feel a little sad seeing the next part of the exercise because that's something that we must think before not patenting our exercises. Lie down on the mat, head down, face down, prone. Fist below your inguinal region. This is again a very common exercise in yoga called as the Shalbha Asana. Lift both the legs up, chin down. Usually utilized for back strengthening exercise and a powerful low back strengthener. Nothing like this, right? It can be done also unilateral and bilateral, whichever way you want. Now relax back. Put your hands behind your back. Bend your knee, both the knees. Fully down. जब मैं कहूँ तो आप हाथों को भी ऊपर खींचेंगे और घुटनों को भी ऊपर खींचते हुए हवा में सुपरमैन जैसा उड़ जाएंगे. ठीक, बंधा हुआ सुपरमैन. लिफ्ट अप, एक बार लिफ्ट करिए, हाथों को खींचिए, घुटनों को सीधा करिए जैसे शलभासन में किया. ठीक है, ये आपका फाइनल पोजीशन है. बेंड बैक, वापस जाइए, चिन जमीन पे है. रेडी? लेट्स सी दिस मैजिक. पुल बिहाइंड, खींचो, हाथ उठाओ. This is a double leg kick, a level 3 exercise from the Pilates format, joining up the Dvikonasana, joining up the Shalbhasana, working on the back strength, working on the upper thoracic mobility. योगा भी कर सकता था, लेकिन आपने छोड़ दिया उसको, शायद इसीलिए पिलाटेस करवा गया. Right? And that is why a physiotherapist must think about these exercises. This belongs to you. And if you don't take it up, somebody else will do it. And then you will end up learning classes on these courses, but you will lose your own things. That's why I request folded hand to all the young and budding therapists. Be prideful of the Indian format of exercises. Now once again, see this mobility and strength training exercise called as the double leg kick. Ready? Knees bend रखिए. एक बार फिर से उठाइए, खींचिए पीछे, जोर से खींचिए, लिफ्ट अप, लेग स्ट्रेट. Yes. A powerful exercise again. Have you all noted this? Thank you. Relax. Sit down. Thank you. Now we have done certain thing for the upper back. We have done certain thing for the lumbosacral spine. We have seen something for the knee and the hip, right? Now, let's not forget the neck as well and the shoulder as well. It's very important part of Pilates training as such. Now, what do I do in a Pilates training? फिर से crook sitting में आ जाइए. Crook sitting. नीज थोड़ा सा आगे करो. यस. अगेन पोस्टीरियर पेल्विक टिल्ट, ये आप सभी चेयर पे बैठकर भी कर सकते हैं. रिक्लाइन बैक, चेयर के लिए आगे आना पड़ेगा थोड़ा आपको. रिक्लाइन बैक. यस. राउंड योर स्पाइन, go down, go close to the backrest and add a chin tuck on that. Don't allow your head to hang behind. Just add a chin tuck. Make sure you're breathing. Relax your shoulder. A simple, basic activity which in Pilates is called as the nod. N-O-D, nod. This nod is utilized to strengthen segmental muscles of the cervical spine. A powerful recruiter of the small muscles in the cervical spine. This is nothing at all which is going to be out of therapeutic curriculum. Thank you. A simple exercise again. Let's conclude the session with some arm involvement. How and where do we have the arm involvement? Now, for example, you're having a rotator cuff injury client being trained. We are all aware of that the rotator cuff can be injured at various levels. And the deepest exercises can always have close kinetic chain activities, trainings. Let us see some powerful exercises which Pilates has to share with close kinetic chain type of activities. Will you do as I show you? Side plank. On the mat, on the mat. I've left the mat for you. Yes. Go in and come up. A beautiful exercise, if you carefully note, which is working on the thoracic mobility and a fantastic deep shoulder loading. But I would have loved, keep a note on what position he is into right now, and I am doing the correct position right behind him. Do you note the difference? My body is right on my hand, his isn't. So he will land up with a bad impingement. Okay? फिर से एक बार रखिए इधर. Yes, that's better. Look up. फिर से थोड़ा शाहरुख खान बनना पड़ेगा आपको. An exercise which turns into a upper back mobility exercise and a fantastic shoulder exercise called as thread the needle. Thread the needle in Pilates training. These are equipments which suits our topic today, that is multi-dimensional approach to a Pilates training. We will love to conclude the session on this, and we are open to any questions. If you have any questions which you would love to ask, let's make it interactive. If you have anything, we will try to handle those questions and answer you as quickly as possible. The session is open for you. Anything that you would like to ask?
Surajeet, before they bombard you with questions, I just wanted to say you whether you have some word of caution. Do you do some preliminary screening to your participants?
Yes.
Do you do that? Please.
Yes. A very, very important question which my loved senior Binay